request our Secretary of IMS, Dr. Aarti Gupta, to introduce today's speaker. Yeah, so Dr. Aarti has been a very enterprising secretary throughout the year, very successful tenure as a secretary of IMS. And also, I must say that this project was conceptualized by her and by Dr. Pushpa, and it has done amazingly well. And Nirja will agree with me that we have succeeded in touching the souls of many, many members of IMS and even beyond, even members of Club 35 plus. So thank you, Aarti, for being here today. We are missing the president, but I think you are representing both Dr. Pushpa and yourself. Please unmute and start the introduction.
Thank you, Dr. Shobha, Dr. Nija, Asna, and Sushma. Thank you so much. And it's my proud privilege to introduce Dr. Sarvdeep Singh Dhatt. I had been in contact already with Dr. Sarvdeep when I am doing the public forum programs for the Indian Menopause Society. So he had been with us at that time also. So सर मैं आपकी तारीफ इसलिए करूंगी कि यू आर ए वेरी वेरी गुड ओरेटर्स एंड आपकी नॉलेज की तो कोई बात ही नहीं तो आई विल स्पीक इन हिंदी ऑल्सो क्योंकि मेरी कुछ कम्युनिटी यहाँ पे हिंदी सुनने वाली भी है तो डॉक्टर सरदीप सिंह दत्ता ही इज प्रोफेसर इन PGIMER चंडीगढ़ एंड her awards and achievements are he is international committee member of Eurospine, International Communities Taskforce of North American Spine Society, and Association of Orthosynthesis Soft Foundation Soft Tissue Management Faculty, AO Trauma Fellow, Herboview Medical Center, Seattle, USA, and so many associations are there, of which Dr. Sarvdeep Singh Dhatt is member, and he is member of Education Committee of ASSI also. So, sir, I welcome you, and I am handing over to you for the further session.
Thank you, ma'am. Thank you, everyone. Thank you, all the panelists, Dr. Neet and everyone.
Welcome, Sarvdeep.
Thank you.
Nice to see you.
Can I share my screen?
Yes, please. Can everyone see my screen?
Yes.
Okay.
Yes, sir.
Okay, so the very interesting topic, and I think so everyone who you meet, I went for Lodi dinner last night, and I think so just before the alcohol was getting served and the drinks were getting served, everyone was coming to me and asking me what we can do. I've got pain in my neck. Can I catch you after the Lodi? Can I catch you before the Lodi? Everyone was just trying to catch me, and it's very, very common what's happening here. And ma'am gave me this talk to talk about what happens with different injuries. So I'm just going to talk about what happens to how we as just humans are getting affected by just touching a mobile device or a computer, and you'll be amazed that I think so maybe 70 to 80% of people who I actually run into will ask me something or something related, and they've had injured themselves just by being on the computer or the laptop or the iPad or different ways by just getting more sedentary, but using these lifestyle modifications such as computers and getting more lazy. And when we talk about computer-related injuries, it could be anything. You can wake up if you've seen a long OTT serial at night and you wake up in the morning with a pain in the neck. It could be discomfort pain. Some people get headaches. A lot of people get affected by this simple injury mechanism. And if you see there's an article in Musculoskeletal Disorders which say that it affects 18 lakh workers. So, and about 6 lakh employees need to take time off just by injuries, by then using in office work, using computers and stuff like that. So you can well imagine 6 lakh people taking off every day is quite a big thing. One of the commonest things which everyone experiences is neck pain. And it's one of the most common disorders which you enter with. I mean, someone coming into OPD, and usually ladies come to us and they complain could be a housewife, could be someone working somewhere, or could be even a security guard outside. They all complained of just pain in the neck and causing them to have a lot of trouble, so much trouble that they have to come to hospital to show their complaint. You can imagine that people spend 5 to 6 hours per day with their head tilted, rotated, reading and texting like this all day long. And if you, newer phones like iPhones and other phones, if you just go down to the screen time, you'd be amazed that an average child spend 5 to 6 hours per day. This is besides his school time. So when he's coming home, or even a housewife in the morning, or anyone, even me, between surgeries or OPD, I'm always constantly checking my phone and checking things. Up to 5 to 6 hours a day you spend per day. That includes, that can be up to more than 1,000 hours per year. You're just having a bad posture. And this is basically causing us millennials into a generation of hunchbacks. And we've lost the, that erect posture which we've been given with. And a lot of people have bull necks, swelling at the back, which they call, basically that's just fat deposition. And the way they walk, they shrunk inside, and they remember the hunchback. Bad posture is the number one cause of neck pain, and it's vice versa. I mean, neck pain causes bad posture causes neck pain. And now, like you see, like I told you, if you spend 5 to 6 hours per day, we're constantly sitting with the arches back. Even mine right now, and we've opened up our laptops or phones, and we're looking down at some different angle to look at the laptop and do it. And that's how it is. No one has told us. No one at school, no one at home, no one has ever told us not to do it, because they are also doing it. So if you have a, like, we did a small Lodi party yesterday before we went out for a dinner, and we were around the bonfire, and all my parents, my wife, everyone was looking down at their phone while sitting in front of the fire. And it's that's how it is. It's an epidemic, and it's caused a lot of problems. As well as the children are more succumb to this, because of they have to have these online classes and other stuff, which always surrounds technology. So it can cause a lot of stuff. It can cause physiological and biological issues. Physiologically, I mean, you will be amazed that just basic migraines, patient not able to sleep, having some problems. Many children become introverts. They don't go out in public. They don't talk to people. They end up having personality issues. I mean, behavioral. They get angry. You take away your phone, or you tell even your. We had a patient last month who came from Sangrur or somewhere in the villages, and she used to play some game on the computer, Candy Crush or something, for like maybe 8 to 10 hours a day. And the husband or someone who should take the phone away, she used to get angry with him. And it's a fact, you could read in the papers also. And I won't be surprised that if so much usage of phone and stuff is also causing issues in the bedroom. Yeah. So it's a big problem, and I think, and it's causing marital problems also. Biologically, it can cause a lot of stuff. I mean, it happens at different age groups, and I think so. Ladies are more prone to these injuries, and it can also affect in other ways if it becomes chronic. There's a text neck syndrome. It's also posterior cervical dorsal syndrome, and it's coined by Dr. Dean Fishman. And he says that the text neck or a turtleneck posture can be described as repeated strain injury and pain sustained from excessive watching or texting on handheld devices for a long time. And I think so we are all guilty of that. And that it has shown that in the many studies have shown that just sitting like that, bending forward, can cause a lot of issues. And people who are spending more than 5 to 6 hours a day are going to come with us a lot of problems. Different studies have, and ergonomics has caused the posture changes, and it's not only the head and neck which is involved. The eyes get involved, lungs, because you slump forward, your lung capacity decreases. Your back pain you get because your posture is like you're just stooped ahead. Your arms are loose. I mean, your hand starts paining, your neck starts paining. I mean, but it's so easy because you can, the minute you leave it, you feel a little better, but then again you have the urge to pick up the phone. The rule, they say that that every 7 to 10 seconds, everyone wants to just check their phone. Yeah. So can you imagine, every 7 to 10 seconds you try to look at your phone and just see what's happening. Did I miss something? Did nuclear attacks happen somewhere, or something happen? I mean, it's amazing that how we are affected by these things, and we are slaves to this. So much though that there was neck pain task force was made, which consisted of many hospitals and many surgeons all over the world, and they've graded into different types. Grade 1 is basically you're able to do your work and get along with stuff. But then grade 4 is when it can even cause something like a fracture, and you can cause issues, and a lot of pain can happen because of this. This is a slide I want you to spend like a second on and take it home. If you remember one slide from my talk today, that if you sit straight, you can well imagine that the pressure from the head going to your neck is about 10 to 12 pounds. That is about 4 to 5 kilos. But the minute you look ahead, look at the extreme right slide. That is the one which everyone sees, and I'm pretty sure everyone in the panelists and the audience sees like that. 60 pounds pressure goes on your neck at the time when you're bending forward. So for every 10 degrees, 10 pounds. Yeah. So if you stand like this and you are sitting in a plane or a car or at home, sitting on the sofa, if you're bending your neck forward, 60 pounds, that is about 25 to 30 kilos pressure is at the time all focused on your neck. So this causes so much pain and neck issues and disc problems and spondylitis or whatever you can call it in your language. But this happens and it's very, very effective. And this actually in the long run leads to a forward head posture. And you will see that patients, I basically ask my patients to just stand straight like a military cadet and stand by the wall to see if they're able to stand comfortably. I mean, let alone old people, the youngsters are also not able to stand by putting their head against the wall and standing straight for more than 2 or 3 minutes, because then they have to slouch in front. It's because the neck, the muscles have got weak, and it's called the forward head posture. You'll be surprised that look at these symptoms. This is just a symptom which is happening just because of the way we are using our phones, the way we use a laptop, and it can cause everything under the sun. You can cause tightness, soreness, migraines, headaches, waking up, insomnia, not able to sleep, and it can cause trigger points. Your hands can pain. So this basic small little phone or your even a laptop can cause so much issues. So technically, if you see that this is the test which I tell everyone to do, I make them stand by the wall and I tell them to stand for at least a couple of minutes. If they're not able to do that, that means their muscles at the back are getting loose and they are getting weak, and the person tends to slouch ahead. This eventually leads to myofascial trigger points. I mean, just trigger points is basically that you can say that for the ladies, it's just below the neck, or where the strap comes right out there. There's a sharp area you can tell your husband or someone, and if you press that area, that is very tender. So this is basically the trigger points start happening, and it's very hard to get it over. And people what they do is they tend to keep moving their arms or shoulders up and down just to get into a comfortable position. And it's okay at home sometimes, but when you go out in public, you will notice that people standing in the subway or the airport will keep doing this stuff like this. So this is actually causing a lot of issue to us, and these trigger points are not easy to treat, and to understand what's causing them is harder, and it's harder to explain to the patient why it's happened. Other than that, you can get issues like tendinitis, tenosynovitis, lateral epiglottitis, ganglion cysts. You get these small cysts which come on top of your wrist, and these are happening because of computer injuries. So CRI, which is computer injuries, is causing a lot of issues to our upper limb, lower limb, headaches, backache. So you can well imagine just such a small device, what issues we'll be getting. Another thing which we get, and I work closely with the neurologists at the PGI, is the cervicogenic headaches. I mean, if you get someone who gets headaches, and I say, "Oh, do you get headaches or you get neck pain?" They said, "We don't know, sir. We get neck pain, headaches all the time." I send them to the neurologist. Neurologist send them back because आपको spondylitis है or something like that. We get X-rays done, MRIs done, which are normal. But basically, these are basically bad posture issues. And you can get cervicogenic headaches, which are very debilitating, and it can affect you. And sometimes if they go into full-blown migraine, they can affect you for 8 to 10 hours a day. So you can well imagine once your symptom starts of cervicogenic headache, how debilitating it will be for you for living around. Other issues, you can get eye symptoms. You get electromagnetic headache risk because of the devices which can cause dizziness. This is mostly in children, and we've got to be careful here. And also, just take this line: children who use more than 1 to 2 hours per day of technology have an increased chance of more than 60% psychological disorders. You can well imagine how badly people are getting affected by just these simple devices. Prevention is the key. That is most important, and I can't pay more emphasis. And I mean, I will manage putting in my talk today, but I'm just telling you that basic stuff. If you just walk and you, the way you sit in your chair and stuff like that, it will help you just improve your posture. And these are red flag signs for neck pain in case someone has issues like weight loss or neck pain or not able to walk properly or something happening. Then obviously it's a red flag, and you need to treat that issue. Conservatively, we give these patients rest modification. I mean, I tell my patients to put a screen lock on the phone, and I try to tell them to put an app on the WhatsApp on social media that I will not check it for more than 1 hour. After that, we get shut. I mean, not everyone follows it, but yes, some chronic cases you have to tell those patients. We can do a lot of stuff, modalities. We can do physiotherapy, psychological therapy, biofeedback. Give them a lot of medications. We need to break the cycle so that they get better. When you come down to a station, I mean, how you work is very important. I mean, this is a good slide to understand that, I mean, even today, right now, when all the panelists are sitting, I don't think so anyone has maintained what this diagram shows. But this is something which you have, and you can get it from the Google. I don't have to tell you, but basically it's how you sit and how you need to have an eye level at the type of the screen, and your arm should be rested, your wrist should be rested, and your chair should be ergonomically nice, and your feet should be flat on the foot. These kind of small things can help you get away from these things. Burger's posture relief position. I'll just talk about it in the next slide, but this is something which is very good, and I also personally practice in my clinics, which I'll just talk about. Other things is stretches. You can do some stretches. The rule of thumb is that for 25 minutes of work which you do, you need to take about 4 to 5 minutes off. So if for maybe half an hour you're working, or 2 hours, or for an hour you're working, at least 10 minutes should be doing something else. Just go into the washroom, go and picking up a pen which is lying far away, or just go and getting a glass of water. You have to break your monotony after 25 minutes of doing working or Netflix or your Amazon Prime, or even when you are in the clinics. So you've got to clean your monitor, make sure everything's fine, and you have to take these breaks. So this is a very good position, and this can be done by anyone, anywhere. And if you can see the figure that everyone has a chair at home, everyone sits in clinics. All you have to do is sit on the edge of the seat, and you got to put your head up, and you keep your chin high and keep it taut, and try to maintain your back straight, and try to maintain it for like maybe like a couple of minutes if you can, and you hold it there. Put your hands out, and it's called the burger exercise, and try to breathe in and out, and maintain this position for a couple of minutes. Even if you do it once every 1 hour, or once even maybe 2 hours if you can, if you don't get time, it can really make your posture good, make your muscles taut, and it will give you a lot of relief in the long run. Other exercises like chin tucks you can do. You can just press your chin against resistance by a hand. You can do flexion exercises to make sure everything's fine. You can do stretches by the arms. This is all is possible. And in the office, you can keep a foam. You can just roll over it if you're flexible. You can do some stretches. And I'm not going to go into the details of how to do the exercise therapy, but these are all things which can be done regularly wherever you want. So basically, to avoid the injuries, is very important to understand what all things can happen because of things. And it can affect us, it can affect our parents, it can affect our children. So every age group is affected by this. Everyone has an iPad on a screen. There is no one who doesn't have a screen. It's very important to understand how much time you can take on it. What is the way to hold your phone when you're reading your phone? How to not get carried away and sit for hours on that place? And what all things can be affected. So it's very important to correct your posture and to understand and listen to your body. And in case you're having issues like a simple migraine, you got to relate it not to stress or some fight or something at home, but it could be just basically due to your technology thing. So I won't take more time, and that's all. Thank you so much.
Sarvdeep, that was wonderful. I didn't expect that when we asked you this simple question, how to prevent injuries for mobile and computer users, I didn't think that there would be such an immense amount of detail and information. I'm very happy that we did it with an orthopedic surgeon rather than just a physiotherapist. And you have really added value to what we know. One question that I had for you was, what are eagle arms?
Eagle arms?
Yeah.
Basically it's a part of a thing that when the arms are not able to slouch, and it's like it's literally like a wasting of the arms, and you're not able to hold up your arm for more than 1 minute at a time. So basically, this is could be neurological problem also, but could be posture related. But mostly it's related to neurological problem. That's what we have seen in our